Welcome to the annual Health Organization Partnership and Curriculum Pitch meeting. My name is Vignesh, and today I will be presenting an educational tool that is aimed at addressing a vital gap in women's reproductive health. As members of the board and partners and advocates for change in reproductive health outcomes around the world, I am glad that we are present to address the current disparities that women from low socioeconomic backgrounds in developing countries face globally. For most women in Australia, pregnancy and childbirth is an exciting time in their lives, and expectant mothers look forward to being recipients of quality care from their healthcare professionals and being able to embrace their healthy newborns and nurture them. These expectations, however, are not the same for expectant mothers from developing or low-income countries. The maternal and neonatal mortality rates are significantly higher than that in Australia, owing to factors such as inaccessibility to healthcare, social disadvantages, and inequitable resources, which results in the lack of pregnancy health literacy. The highest maternal mortality rate in the world belongs to Sierra Leone, with a shocking 1,360 maternal deaths per 100,000 live births, in comparison to the average of 8 maternal deaths per 100,000 live births recorded in Australia. If we were to relate it within context of a major tertiary hospital in Australia, with an average of 3,000 live births per annum, that equates to 140 maternal deaths per year, or 3.4 maternal deaths a month. This is unacceptable and would never happen in Australia, but it is a nationwide reality for some countries. This is without a doubt a global emergency. Even if a woman can attend one antenatal care session in a pregnancy, critical information such as when to seek help should be disseminated to her. If she takes home anything that day, it should be that she should seek help if she experiences any symptoms at home requiring obstetric care. The lack of health literacy in pregnancy is commonly seen in women who are unable to access antenatal care, and as a result, critical signs and symptoms of pregnancy-related abnormalities go missed, which may potentially have fatal consequences. This infographic is an example of concise but crucial information that women should receive education on during their pregnancy. I propose that this infographic may be made available in all health clinics which women visit for their antenatal care during their pregnancy. The succinct language and terms used in this infographic enables it to be translated easily to the languages and dialects spoken in various communities and countries around the world. This infographic has been kept easy to read and simple to understand with the aim of educating women globally, regardless of their existing health knowledge, and thus addressing equitable educational methods and tools incorporated into this proposed curriculum. Although far bigger movements and initiatives are required to address all the factors responsible for equitable antenatal care for women in communities with large socioeconomic disadvantages, this poster has been created in the hope that it would be able to deliver the message to women and reinforce the importance and urgency to seek antenatal care in a timely manner, which might be potentially life-saving. Our stakeholders would first and foremost be pregnant women receiving antenatal care, but also health clinic professionals, obstetricians, midwives, and the World Health Organization committee responsible for advocating the circulation of crucial healthcare education material. The continuance of this proposed project is dependent on the evaluation of maternal and neonatal outcomes in 1 year succeeding the implementation. It is expected that we see improved maternal and neonatal outcomes and a reduction in maternal and neonatal deaths recorded per annum. These positive outcomes are highly anticipated and likely given the empowering nature of this project. This curriculum pitch is a learner-centered initiative aimed at yielding patient-centered outcomes. Consider this: an average expectant mother in Australia receives 10 antenatal appointments, of which this information is reiterated 10 out of 10 times. Don't women around the world deserve at least one appointment to tell them that green-stained amniotic fluid is not normal and they could potentially be developing sepsis? Even though larger factors need to be addressed to reduce the maternal and neonatal mortality rates, could we imagine the difference it would make in the next decade if more and more women sought obstetric care when experiencing complications during their pregnancy? What would it like to be to halve, even quarter, the number of maternal deaths that Sierra Leone faces every year? What would it be like for women to believe that pregnancy and childbirth should not be potentially fatal experience of their lives and instead a joyous occasion to be celebrated. I thank you for your time.